Carpal tunnel seems to be something which, lots of people get these days. They say it's from, doing one-sided work on the computer, whatever it may be. How do you treat it in your practice, and is there hope for it at all?
Sure, there's hope. The way we treat it is try to figure out what is causing it. A lot of times it's caused by a repetitive strain injury. What that means is they're overusing their hands and their fingers and their wrists. For example, if they do the same, they have a factory job and they're doing the same repetitive work with their hands all day long, 8 hours a day. They can get this repetitive strain injuries. A lot of these folks, they may be working overtime. I had one patient, she was working 60 hours a week, and that's like 6 10-hour days. And she couldn't quit. She just needed the income. She couldn't quit her job, or she couldn't even back off to do regular duty. So the key to treating it is to convince folks to do something where they don't repetitively overuse their hands. So what we do is we put them in splints, we put them in physical therapy, and we give them like light duty restrictions. And a lot of times that clears it up. Sometimes they have to go to surgery where they make a small cut in the wrist to release the pressure on that nerve.
I see. So laying off, so summarize it for me. Laying off of the repetitive action is an important thing, maybe even a must, but many of us cannot do that. Because like that lady you mentioned, 60 hours a job and whatever she does, screwing something in, doing something, typing, whatever it may be, she has to do the repetitive action. So,
well, the other thing you can prevent it, what we do at our office, say in our office, we have ladies where we get them ergonomic keyboards. They're the split keyboards, and your hands and wrists are in a position to cause less sprain on the wrist. So we've got that for everybody. It's a little bit more expensive, but it's cheaper than crippling someone. And if someone starts getting numb in their fingers, we put them on wrist splints right away, and physical therapy. And so prevention is one of the keys. And what I tell them is, like, if you're typing, as soon as it starts getting numb, back off and do something else where you're not typing.
So what I'm getting,
and another thing we can do is, like, if someone does a lot of data entry, there's software where you can talk to your computer and the computer will type up what you're saying. There's a software called Dragon, Naturally Speaking, and that's wonderful. It's you can basically run your computer and type letters just by talking to your computer. It's very accurate now.
Yeah. Absolutely. But one of the main thing I'm getting out here is you've got to do alternative, different type of exercise than what you do, so that, basically it relaxes that muscles. If you do one action all the time, you with physical therapy try to figure out different movements so that then it's not just that one muscle, that one movement which is constantly there, but it actually evens out, which is what sports people do. I mean, don't a particular sports person, let's say a skier, he strengthens the muscles he needs to ski, but he is urged by his coaches constantly to play a few other sports so that it's not only using those muscles.
That's exactly right. And what we do is analyze what they do at work, and try to figure out ways where they're using different muscles. Exactly.
Right. So that alone, a person can go a far way just by him thinking of what to do on it. Okay. Have you found massage to be in that area a helpful thing when a person has carpal tunnel type of stuff?
Not necessarily.
Okay. All right. Good. Well, all right. Thank you very much for letting us in on the secrets and some prevention tips on carpal tunnel. Bye-bye.